Good evening, everybody. Today we are going to try to discuss about CIWA-Ar protocol, also known as CIWA protocol, CIWA, Clinical Institute Withdrawal Assessment for Alcohol Revised. That's how the name came, CIWA-Ar, Clinical Institute Withdrawal Assessment for Alcohol Revised. So this protocol is basically used at the hospitals of advanced countries for patients of alcohol withdrawal syndrome. We have to go a little bit background with this topic because it depends on alcohol and is normally needed for the alcohol dependent patients. This video will be important for the nurses, for hospital pharmacists, pharmacy technicians that work at the hospital, and also for the pharmacy students who plan to work as a hospital pharmacist after graduation, and also for some doctors. And alcohol is religiously restricted in some religion, one of the religion being Islam. So this problem may not be that severe in Muslim countries because of religious restrictions on drinking alcohol. But we have to remember one thing though, that in those countries, because of not taking this issue seriously, hospitals did not develop good protocols for tackling this issue. Even though it's religiously restricted, that doesn't mean that there is no alcohol dependent patients over there and alcohol withdrawal syndrome for which the patients come to the hospital doesn't happen over there. So this video will be basically important for those countries that didn't develop the protocol yet for dealing with this type of patients. For advanced countries, it may not be that important because they have already developed the system and the protocol for dealing with this issue. Alcohol use is the seventh leading cause of death and disability around the world, and some people suffer more from alcohol withdrawal symptoms than others, and there may be a genetic predisposition for that reason. Alcohol withdrawal usually does not occur in general population because they drink little, so they don't get the high sustained blood level of alcohol to develop tolerance to alcohol. We know alcohol is a CNS depressant. Alcohol increases the inhibitory effect of GABA, gamma aminobutyric acid, and decreases the excitatory effect of excitatory amino acids such as glutamate and dopamine. When an alcohol-dependent person undergoes alcohol withdrawal symptom, these CNS depressant effects of alcohol are reversed and patient experience unregulated excess excitation. Alcohol withdrawal symptoms can range from minor to severe. Minor symptoms could be insomnia, tremulousness, mild anxiety, gastrointestinal upset or anorexia, which means loss of appetite, headache, diaphoresis, or palpitations. Patients can have seizures from alcohol withdrawal, and for alcohol withdrawal seizures, use of benzodiazepines, phenobarbital, and propofol are recommended, but the use of carbamazepine, valproate, and levetiracetam are not recommended. And patient can also have alcohol hallucinosis from alcohol withdrawal syndrome. Patient can also develop severe symptom delirium tremens, which typically begins between 48 and 96 hours after the last drink. CIWA-Ar score is calculated based on the assessment of patients' alcohol withdrawal symptoms. Patients are asked some questions or observed for some of the symptoms and then scored based on that. The first one is nausea and vomiting. then tremor, and then sweating. Then patients are asked for tactile disturbances, then auditory disturbances, and then visual disturbances. Patients are then asked for level of anxiety, then observed for level of agitation, and then asked for headache or fullness in head, and then asked for orientation and clouding of sensorium. You can use this calculator free from the website MDCalc, which is MDCALC. Here you can see how by inputting different values for different symptoms of alcohol withdrawal, someone can get the total CIWA-Ar score, and the questions that to be asked to the patients for determining these scores are also given here. Here is an example of an alcohol withdrawal protocol for physicians to use at a hospital. For alcohol withdrawal patients, ordering IV fluid is important, and for medications, multivitamin, thiamine, and folic acid needs to be ordered. And if a patient cannot get PO meds or oral meds, then an IV fluid is ordered containing IV multivitamin, thiamine, and folic acid and magnesium. Since that bag looks yellow in color, is called a banana bag. The protocol will need some medications for patients' nausea and vomiting, and also option for treating patients' hallucination. And if a patient is found to be smoking dependent too, then a nicotine replacement protocol should be initiated for smoking cessations. The main portion of this order set is to choose one benzodiazepine and give it to the patient based on the CIWA-Ar score. The benzodiazepines that can be used for this purpose are lorazepam, diazepam, or chlordiazepoxide. Lorazepam and diazepam can be given either by mouth or IV, but chlordiazepoxide can be given only by mouth. Here is an example of a form that nurses use at the hospital for determining CIWA-Ar score for alcohol withdrawal patients. They can document the date and time on this form and calculate the total CIWA-Ar score on this form. It also tells the nurse what dose of lorazepam, diazepam, or chlordiazepoxide to be given to the patient based on the CIWA-Ar score, and if the score is found to be high, then when to call the doctor. And it also tells the nurse at what frequency CIWA-Ar score should be assessed based on the patient's CIWA-Ar score. Implementing a protocol like this at the hospitals around the world can save many people's lives. So please share the video and subscribe to the channel. I'm planning to make more videos on different topics in future. So see you next time. Thank you.